Functional Physio. Presents ePoster 2020. Associated by Mind Academy and Sportson. Presenter KONGAIYA B. On title: Diastasis Recti Abdominis.
A warm greetings to all. Myself KONGAIYA B, pursuing my BPT degree at Raja Muttaya Medical College Hospital, Annamalai University. First of all, I would like to thank for the opportunity given to me to present myself and to be productive during this quarantine period. Without wasting much time, let's get into our presentation. My presentation is on Diastasis Recti Abdominis. As the name suggests, diastasis is the separation and recti abdominis is the rectus abdominis muscle. As per definition, it has been said that it is an impairment characterized by an increase in midline separation of the rectus abdominis muscle due to widening and thinning of the linea alba. So before getting into this topic, let's brush up some basic relevant anatomy. So the rectus abdominis muscle, also known as the abdominal muscle, is situated in the anterior wall of the abdomen. It has its origin on the crest of the pubis and it is inserted into the costal cartilages of the ribs 5 to 7 and into the xiphoid process. So coming to linea alba, it's nothing but the fibrous tissue which is situated at the center of the anterior abdominal wall, which separates two bellies of the rectus abdominis muscle. So coming over to incidence, this condition is more commonly noted in pregnant and postpartum women. Does age factor plays a role here? Yeah, of course, age factor do play a role over here. Women more than age of 35 and who have multiple pregnancies have been commonly noted with this condition. And this incidence peaks most commonly in third trimester. So what causes this condition? Yeah, it is definitely absolutely due to the growing fetus. During pregnancy, the LA, that is the linea alba, softens due to hormones such as progesterone and relaxin. The expanding uterus causes the rectus abdominis muscle to elongate while altering their angle of attachment, which in conjunction with the hormonal changes leads to stretching of the linea alba, increasing the distance between the two parallel bellies of the rectus abdominal muscle. This causes increase in IRD, that is the interrectal distance. Clinically, this condition has some clinical presentation such as low back pain, weakness and instability mainly over abdominal area. This causes functional limitations such as bending, walking, etc. And the main thing is there is decreased protection to the inner growing fetus. If this separation is not being noted and it is allowed to expand more and more, this may lead to herniation of the inner visceral organs. Then how does a therapist examine this condition? Yeah, it is truly based upon palpation. The patient is being placed in hook-lying position and then the patient is asked to raise her head and shoulder reaching towards the knee while the therapist palpates the medial edge of the rectus abdominis muscle in order to rule out the separation. This examination is to be done at the umbilicus, over the umbilicus and below the umbilicus. These are the regions where separations is being commonly found. So if the separation is more than 2 cm, it is being considered significant. So regarding the management of this condition, it is purely based on physiotherapy. So the foremost thing to see here is educating our patients on this condition during pregnancy and after pregnancy in order to manage our patient expectation, limit fear, anxiety, etc. and prepare our patient for pregnancy and birth related changes their body undergoes during and after pregnancy. Okay, so coming to exercises, the main exercise prescribed for this condition is head lifting. The patient is being positioned in hook lying with her hands crossed over midline, the arm, so that it supports and approximates the rectus abdominis muscle. So have the patient exhale and lift only a head off the floor, simultaneously approximating the rectus towards the midline by moving their arms. So then have the patient lower her head and relax. So these exercises can also be combined with performing pelvic tilt. For that we have to follow the same procedure, but during approximation of the rectus muscle we have to ask the patient to perform posterior pelvic tilt and then lower the head and relax. So all abdominal contractions should only be performed with exhalation, so that we can reduce the intra-abdominal pressure. And then exercise to inner unit muscles. The inner unit muscles mainly includes the transverse abdominis, pelvic floor muscles and the diaphragm. So how can we engage transverse abdominis in this? Have the patient to maintain a supine or side-lying positions and palpate their TA muscle using their fingers in the lower abdomen, and then ask the patient to draw in their abdomen by contracting the TA muscle while performing relaxed breathing. That is very important here, so that it becomes compulsorily necessary to reduce the intra-abdominal pressure. So then coming to pelvic floor muscles, how can we engage them? The same position is to be maintained by the patient, and we have to instruct the patient as if they are controlling the flow of urine. Okay, this causes contraction of the pelvic floor muscles. And then diaphragm. It is commonly known that diaphragmatic breathing or lateral costal breathing can be prescribed to engage diaphragm here. So is there any need also to engage our inner unit muscle? Of course, there is a need. These inner unit muscles are mainly involved in producing the tension which is necessary for maintaining the stability of our abdomen. Abdominal supports. Abdominal supports or abdominal binding can provide additional support and comfort and can help with the proprioception for women in early postpartum period and increase the patient's confidence. So coming here, if an abdominal wrap or binding is going to be used, it should be initiated immediately postpartum and worn for support for approximately 8 weeks or until the patient has the ability to generate tension in the inner unit during activity. External support should always be used in conjunction with the inner unit activation and exercises to regain control and coactivation of the inner unit muscles. Additionally, abdominal bindings should always be wrapped from bottom to top to avoid an increase in pressure on the uterus and pelvic organs, which can cause downward descent or prolapse of the pelvic organs. The abdominal wrap should offer light compression or gentle hugging, as too much compression can increase the intra-abdominal pressure. It has been known that elastic binders can be used over non-elastic binders, as elastic binders are more likely to promote recovery than non-elastic. Additionally, elastic wraps allow for greater movement and are less likely to restrict breathing. So apart from this, bed mobility exercises, teaching patient how to lift an object can be taught along with this, and surgery. Regarding surgery may be prescribed in severe conditions where there is a herniation of the inner visceral organs. At last, hope I am done with my presentation, and I hope that it reaches everyone to some extent. I have done my level best, I think so. So then I would like to thank again Functional Physio and Mind Academy for providing me this opportunity. So thank you.